Congressman James Lankford from the 5th District of Oklahoma. Quick conversations. We've had multiple conversations about healthcare, what's happening nationwide, as well as what's happening in Oklahoma. Let me just tell you a quick story, though, before we jump into that. One of my family traditions with my extended family over Thanksgiving is that after we've had Thanksgiving meal and everyone's all sitting around, the newspaper comes out and everyone starts going through the sale ads to start talking about all the different shopping. And we're not just talking about just price, we're also talking about quality and what people want. It's gifts, and so it's important to us that it's right, but it's also the right price. And so we go through that and begin to compare. Well, if you take that same analogy that many families do around Thanksgiving time and shopping and other moments, you take that over to healthcare and say, okay, you have a certain procedure that you need to have done. How can you shop the best price? How can you know quality? Is there any place to do that? Well, in the middle of a national conversation about healthcare right now, there are very few conversations that are really occurring about the price and the quality and how do you research that out and what's the best limiter. In the President's healthcare law that was passed now 2 years ago, the way that they control costs from the President's healthcare law is by a board called the Independent Payment Advisory Board, IPAP. It's kind of an IRS for medical. That medical IRS, they go through all procedures and they determine which procedures cost too much, which procedures cost about right, what will be the exact cost for visiting your doctor or going through a procedure, or how much a hospital will be. And if they determine this medicine costs too much, they just won't be available. That's the IPAP board. That's how they control costs with the President's healthcare board. I'm one that goes back to and says, is there a free market solution in this? And so as you begin to look around the nation, look for how do we control cost without having to have price controls set by the government, it begs the question, where is that really occurring? And so we have one of those locations happening in Oklahoma, actually. Dr. Smith is visiting with me here today. I'm going to let him tell the story a little bit about what they've been doing and how they try to explore this same question of how do you deal with cost and can you really put prices out. So I appreciate very much the conversation that we're having and being able to talk through these options. I want to get a chance for you to be able to share your ideas as well. Well, first of all, tell us a little about your facility, the age of it, and how this idea came about how to control pricing and how to be able to set prices that get out there.
Well, I'm anesthesiologist, run the Surgery Center of Oklahoma. We opened in 1997 and been open uninterrupted since. We've always adopted an honesty and pricing model, but decided that about 4 years ago we were going to display those prices.
So when you display those prices, you're talking about posting them out on the internet.
Yeah, they're out online. They're out there. One of the first things that happened after we put these prices online, as I've told you before, is the Canadians started calling. And they found our prices reasonable enough that they would pay that price to not stand in line for months or years to get their procedures. We then had patients come from surrounding states. That continues. Big self-insured companies have noticed the difference between what we have posted online and what they're paying at big hospitals across town. The spread usually is 5 to 1, but oftentimes is 10 to 1, we being 10% of the price of price across town. Interestingly too, hospitals that have been losing business to us by virtue of posting these low prices have been actually matching our price. And we've had 4 patients now who have been quoted by large hospitals not known for providing discount care to the dollar what we've charged online. So found that interesting. So this free market, transparent pricing model is helping people that we take care of, but it's also having a deflationary effect on costs in the Oklahoma City area.
So for individuals that know that they have a certain procedure that they need to have done, they're going through the process, they're trying to explore, and right now there's a lot of questions about it. I want to pick my doctor, I want certain hospitals, I want certain facilities, but they're also evaluating price. And so if someone says, you know what, I like the particular look of this hospital, I want to go there, they can choose to do that, or they can say, I'm looking for a price and a particular physician that I like. They may also look at your surgery center and be able to come and have the procedure. The difference is they'll know your complete price up front, and it's an assured price.
It's an assured price. It includes everything. It's a package price. Furthermore, if the surgeon determines that a certain procedure needs to be done, and during the procedure we find out other things in addition need to be done, we stand by our original price. There's no bait and switch, different sort of add-on later.
Okay. the basics of this is the free market getting into healthcare. To say we can put prices out there, put quality, we can put all the different details so people can see it, they can view it, and they can judge it. What you're seeing with that is not only competition in the Oklahoma area, but also in other states, people from traveling all over the country, people traveling outside the country, what we call medical tourism. I know you know that well.
Yeah.
People that will shop around now and look for not only price but quality and be able to evaluate, and they're willing to take the drive. With a lot of surgeries being a day surgery, they could come spend the night in a hotel and then come and have a day surgery, then be able to leave out. And it's actually cheaper to do it here in Oklahoma and with all the travel than it is in almost any state.
Especially at a 5 or 10 to 1 spread. That's definitely the case. And I look forward to everybody posting their prices, and let's have some healthy competition that all other businesses have to deal with. If I have a competitor that posts his prices and he matches our price, I'm going to respond to that. And the beneficiary of that response is going to be the person paying for the care.
Well, I appreciate you very much coming in. I appreciate what you're doing and how you're trying to bring additional transparency into the healthcare industry.
Thanks.
There are a lot of ideas that are out there on healthcare, and there are a lot of ways to handle this besides the government stepping in and controlling all prices and controlling the way that we're going to function as healthcare. What we want to have is the maximum amount of time that we have the doctor, physician, surgical centers, whatever it may be, relating directly to that patient, determining price, quality, procedures, what needs to be done, and to not have an independent payment advisory board from Washington, D.C. telling every doctor and every hospital around the country what they charge, how they do it, and what they can and can't do on that. Let's get it back to the patients on there. A lot of ways to explore that. This is one of the great ways that's happening right now, and look forward to it catching on around the country. So thanks for stepping in on this. We're going to continue an ongoing conversation about healthcare in America and in Oklahoma, because this issue has to be resolved and has to be done right. Thank you.